Hi everyone, in today's video, we're going to discuss what to expect as an RN, LPN, and healthcare aide during your triple track Inspire Global Assessment. So let's get started. Let's start with the basics. What is the triple track assessment? The triple track assessment is a multi-level assessment that is designed to evaluate IENs across 3 professional levels. So that's the RN, LPN, and healthcare aide. The triple track assessment will help regulatory bodies, for example, BCCNM, if you are practicing in British Columbia, to determine which designation best fits your current knowledge, your skills, and your competencies. Also, it will help determine what further education or exams you may need. For the triple track assessments, it includes the CBA or the computer-based assessment and the simulation lab assessment or SLA and an English language assessment as well if needed. So depending on how you do during your triple track assessment for the CBA and the SLA, you could be placed into one of the 3 tracks: registered nurse, LPN or licensed practical nurse, or healthcare aide. Next, let's discuss what is the SLA, as this is one of the main concerns for IENs compared to the CBA. So the SLA stands for Simulation Lab Assessment. The Simulation Lab Assessment is a clinical skill-based exam. So during this assessment, the assessors or Inspire Global Assessment will test your current skills and how do you apply your knowledge and the nursing theory into patient case scenarios. So during your triple track assessments, it includes 10 case scenarios. So you have 5 simulated case scenarios for RN and LPN and 5 simulated case scenarios for healthcare aide. During the assessment, it will assess your clinical knowledge, clinical judgment, the way you communicate, so communication, interprofessional relationships, safe practice, and your professional behavior. During the simulated case scenarios, it will evaluate your practice at both the RN, LPN levels and also the healthcare aide level. And then your performance during the SLA will help determine which designation, RN, LPN, or healthcare aide, you're most aligned with in terms of competence and your readiness to practice. And that's why I keep repeating this over and over. It's very important for you to set aside time to study, practice, and study again for the CBA, but most importantly, the SLA. In addition, it's important for you to understand the different role expectations during your simulation lab assessment. So now let's discuss the responsibilities for the RN. In RN case scenarios, the assessors will look for your ability to perform a comprehensive exam. So that means you're able to do a physical exam, psychosocial, and also determine risk factors for the specific case scenario. Next, you know how to demonstrate critical thinking and clinical judgment in managing unstable or complex case scenarios or complex patients. As you are the RN, you need to know how to prioritize and delegate tasks as needed. Next, you have the ability to initiate and evaluate a plan of care independently for your patient, depending on the prioritization, depending on what is happening to your patient during your case scenarios. Also, you know how to communicate effectively, so you can use frameworks such as ISBAR when doing handovers or calling the physician. Next, one of the most critical skills that you will be assessed during SLA when you're RN but also LPN, you know how to safely administer medications. For RNs, you know how to administer high-risk medications and you know how to interpret abnormal labs and diagnostics. And how does that translate into your patient's care? Next, you know how to respond to emergent situations with leadership and sound decision making. You also need to know how to collaborate effectively with the interdisciplinary team. Next, let's discuss the LPN responsibilities. In LPN-focused case scenarios, you are expected to deliver safe, competent care to patients with predictable and more stable You know how to collaborate with the RN and the interdisciplinary team, and you know when to consult them if this patient is not so stable anymore and your patient starts to deteriorate. Like I mentioned, you need to safely administer medications and also perform wound care as needed, and you need to know how to assess a wound. In addition, you are able to recognize and report deterioration or any changes in your patient status. You know what you need to do in terms of your step-by-step in your prioritization when a situation escalates. Next, you know how to communicate effectively using therapeutic communication, not only with the patients, but also family members, but also the interdisciplinary team. So when you're doing handover or handoff or calling the physician, for example, you are able to do basic assessments, focus assessments, and provide interventions as needed. You know how to document care accurately and concisely and report concerns using the ISBAR framework. During your SLA or simulation lab assessments, the assessors will be watching closely for whether you're practicing within your scope. So when you are an RN and you are more passive, you're not assertive, or when you're an LPN and you're too independent, you don't know when to escalate care or when to collaborate, that could work against you. During your preparation for the CBA and SLA, it is critical to study both scopes of practice and to understand the level of autonomy and adjust your critical thinking and your clinical judgment based on the scenario that you are presented. For HCA or healthcare aid role, your responsibilities will include supporting ADLs or activities of daily living. Some of the skills that you might see would be patient transferring, feeding, and also hygiene, providing emotional support to your patient, observing and report changes. So when something happens to your patient, you know who to call, you know when to escalate, you know when to call the RN or the LPN. Also, maintaining a safe environment, a clean environment, and following proper infection control and hygiene. Your SLA performance will be evaluated based on how you perform, on how you demonstrated role-specific competence. So for RN candidates, you need to show independence, you need to show critical thinking and clinical judgment. You need to know when to prioritize. For LPNs, you were able to provide safe, supportive care, appropriate escalation, and collaboration. For healthcare aides, you were able to demonstrate skills in a supportive and respectful manner, and you were also able to accurately report any changes with your patient. Now, here are some essential SLA preparation tips for you. So first, know your scope. Don't overstep, but also don't underperform. So with RNs, you are expected to lead. As an LPNs, you know when to collaborate, you know when to escalate when the patient is deteriorating. And as a healthcare aide, you know when to report and also assess as well. So study your provincial competencies. So how are you going to do that? If you are practicing in BCCNM, then you would go to their website or XCNO and then review the scope of practice. Definitely, your case scenarios will require you to do nursing skills. So practice your head to toe and also your focus assessments. And also, as the SLA is also time, it's good to practice within a certain time frame. Doing it in 10 minutes or less, that'll be perfect. And start with your ABCs and your vital signs. So your airway, breathing, circulation, and also your vital signs as part of your nursing assessment. Next, apply the clinical judgment model if you can, and I'll discuss that in the next slide. Number 4, use ISBAR in communication. So using frameworks such as ISBAR, it'll help you be more organized when you're calling the physician or when you're doing handover, and practice concise and confident handoffs, but also calling the physician will be helpful before your SLA. Next, hand hygiene, PPE use, and isolation precautions are also critical. Before your SLA, it's good to review how to don PPE, but also how to doff off PPE. During your SLA, time is limited, so know how to manage your time effectively, and also prioritization is key. Next, stay calm and professional. So respectful communication, empathy, and documentation matter. Use therapeutic communication and active listening in all case scenarios, but most importantly, during mental health case scenarios. The clinical judgment model, or the CJMM, is something that you can use during your case scenarios. This is a framework that can help guide you in your critical thinking and your clinical judgment. So first is to recognize cues and how to analyze them. As nurses, we collect and analyze relevant data from our patient, from medical records, from other healthcare professionals. And using this information, you would be able to prioritize and generate solutions. Using this information, using this data, you need to know how to interpret and analyze them so you can identify patterns, risk factors, and you are able to anticipate potential problems or symptoms that the patient would be complaining of during your case scenario or in real life scenario. Next, using all of this information, you can prioritize the most critical problem or issue of your patient and develop plans of care based on your critical thinking and clinical judgment. Lastly, is you would take action and provide interventions to your patient. I talk about frameworks like this and more, and how to prepare for your CBA and your SLA in my upcoming IEN prep course, Mastering Canadian Nursing, CBA and SLA preparation for IENs. And I am launching it next week, so stay tuned for that. I will talk more about it at the end of this video. So here's more study tips for you. Set aside enough time to prepare for your exam. And this is something that I keep telling my nursing students, that I know you guys are excited to practice as a Canadian nurse, but for you to reach your goal, you have to be able to perform well during your CBA and SLA, and especially if you haven't been practicing for a while. And that's why it is critical for you to prioritize reviewing and studying and using the right resources to prepare for your CBA and your SLA, as this is one of the most important exam you will do for you to reach your goal in practicing as a nurse here in Canada. Next, practice and review case scenarios that mirrors the SLA simulations. Next, review nursing theory and skills, especially if you haven't been practicing for a while. Use study materials and resources, but I highly suggest making your own notes as well, as that will help you remember more. It's good to record yourself practicing case scenarios and say your actions out loud. This is something that I mentioned to my coaching clients, but also my students, is during your SLA, it also helps to verbalize every action that you're doing. Because for example, you are doing a skin assessment. For a skin assessment, you are looking at the patient's skin. You're looking if the patient's skin is red, for example, right? If you are just looking at the patient's skin, if I'm the assessor, I don't know what you're looking at. So it's good to verbalize what you're doing. So how would you do that? Is you would say, next, I will be doing a skin assessment, and when I'm doing the skin assessment, I am looking for any redness, any bruises, right? Things like that. So the assessor will make a note that you know your stuff, you know what you are assessing for, as the assessors cannot read your mind. Preparing for the triple track assessment and the SLA more specifically can feel overwhelming and stressful, but with clarity on your role, consistent practice, you can absolutely succeed in doing your CBA and your SLA. And whether your goal is to be an RN, an LPN, or healthcare aide, each pathway will bring you closer to practicing in Canada. And now it's about targeted and focused preparation. Trust in your experience and continue practicing. And if you need more support, I do offer private and group coaching. And like I mentioned, my online self-paced course is launching soon. It's launching next week. Mastering Canadian Nursing, CBA and SLA preparation for IENs. Due to popular demand, I created this course for you. I've been a Canadian nurse for 18 years, and I put all of my experience, skills, and knowledge in creating this course to help guide you and give you structure and preparation for your CBA and your SLA. And this course has everything you will need to help you succeed in your CBA and your SLA preparation. So if you haven't yet, join the waitlist to be notified once it is out. And I'm excited to work with you in achieving your goals. And that's it for our video for today. Until next time, stay focused and believe in your nursing journey. You've got this. I'm cheering you on. I'll see you in the next video.
If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video!